The perception of mental health carries along with it a huge stigma, and especially when we add cannabis in that mix. What is mental health? Most of us know mental health as the emotional, psychological, and social well-being. There are biological factors, life experiences, and family history. In 1970, Maslow emphasized that mental health is associated with an individual's motivation towards self-actualization. Self-actualization is simply the state of being psychologically healthy, fully human, and highly evolved and fully mature. That's a lot for somebody with a mental health disorder. Today, I want to present to you 3 case studies. I've been a nurse for 25 years. My background is geriatric and psychiatric nursing. I'm currently a psychiatric nurse at an acute psychiatric hospital, and I'm also a cannabis nurse navigator. The stigma for cannabis in the mental health specialty is still very significant. So I hope you enjoy following me through a journey in a psychiatric hospital and how the perception of we look at mental health can change and how we look at cannabis can change. Our first study is a 17-year-old Haitian male. He came to the hospital acutely psychotic. He hadn't slept or showered in 5 days. He had homicidal ideation towards his mother. That meant the thoughts in his head were telling him that he needed to kill his mom. Those are known as auditory hallucinations. To him, they were real. He felt that he needed to take the powers away from his mother, that she had these superhero powers, and the voices were telling him that she had to die. He was also positive for THC. The second patient is a 35-year-old married Caucasian female. She came to the hospital with suicidal ideation, which is thoughts that she wanted to kill herself. She was a cutter, which is part of self-injurious behaviors. So just from the paperwork, we can safely assume that she's probably borderline personality disorder, or often labeled as such. She has 60 different personalities, she says. She was assaultive and physically and chemically restrained in the emergency room before she came to us. She was also positive for THC. The third case study is a 73-year-old retired married male. He came to us suffering with anxiety and depression. On April 28th, he had 2 suicide attempts. He was diagnosed with severe alcohol use disorder, and he had a permanent colostomy that he had just gotten in the past year that severely affected his quality of life, increasing his depression and his anxiety. He was also positive for THC. When we look at mental health and some of the patient diagnoses that I care for in the acute psychiatric hospital, we have diagnoses such as neurocognitive disorders, substance use and addiction disorders, schizophrenia spectrum and other psychotic disorders, depressive disorders, bipolar and related disorders, anxiety, obsessive compulsive and related disorders, trauma and stress related disorders, somatic symptom and dissociative disorders, eating disorders, and personality disorders. And oftentimes, those patients are positive for THC. Every patient that comes to the acute hospital that I work in is diagnosed with cannabis use disorder. Cannabis use disorder is the continued use of cannabis in spite of the serious distress or impairment it causes. As cannabis nurses, we have an obligation to our patients. It has been determined by the National Council of State Boards of Nursing that we are supposed to be educated in the endocannabinoid system, and we are supposed to ethically take care of our patients who use cannabis as medicine. Understanding the needs and understanding the endocannabinoid system is what's going to help turn and change the stigma of mental health in those who use cannabis. Out of those 3 that I chose, I want you to look at the perception. I had a 17-year-old male who was Haitian. He was on the acute adolescent unit. I had a Caucasian female who was 35. She was on the acute adult inpatient unit. And I had a 73-year-old married Caucasian male who was on the jury psych unit. All 3 of those populations were positive for THC, but we don't ask if they have a medical card. We don't ask if they have a condition in which they are using their cannabis for. We simply place a label on them and add to another negative stigma that they have to carry with them. I hope this presentation changes how you look at your patient. I hope this presentation changes how you look in the eyes of someone suffering. And I hope this presentation changes how you look at the way we judge those who use cannabis for medicine.